Hi guys! Okay, so a couple of weeks ago, maybe it's been a month ago, I asked you if you wanted to know about my veneers, and a resounding amount of people said yes, and then I had you send in questions about like what you would want to know. So here we are. I'm going to, because it's IGTV, we only have 10 minutes. It's really not a overly complicated topic to tell you about, so let's get into it. My forefront teeth are veneers. I've had them for a year and a half now. I got them done after pregnancy by Dr. Gill here in Louisville, Kentucky. She owns a practice called Natural Smiles. She was trained in Scottsdale and Beverly Hills, and that's why I liked and trusted her. And I think she did a great job. So I originally got veneers because of a rather embarrassing scenario, but when I became pregnant, one of the side effects, I guess, of pregnancy is you have a lot more blood in your system. So my blood all decided it was going to go to my gums. Yeah, gross. And in between my original two front teeth, I literally like had a growth on my gums, like it protruded. It was disgusting. And obviously someone who is in the beauty community and like my ego could not handle it. And so I went to an oral surgeon and I was like, what is this? I was freaking out, and he basically explained to me that it was just a growth on my gums from pregnancy, and if I waited till after pregnancy and all of the blood had left my system, it would go down and be fine. And at this point I would think I was only like 3.5, maybe 4.5 months along, and so I was like, no, we're not going to be able to do that, buddy. So he was nice enough to cut it off. So he had to put like a numbing shot in the actual like tiny growth. It was probably like half of it of an eraser size, but it was noticeable. Like if you go back and look at my photos when I'm pregnant, half of them I am not smiling with my mouth open, which isn't really like me because I was like, so it was not cute. So he cut it out and it looked better. It wasn't like fantastic, but it looked better. Fast forward to after pregnancy, it did almost start coming back at the end too, which I'm like, are you for real? But by that time I only had like 2 or 3 weeks left, or maybe a month. And so I just decided to like wait it out. So it did go down after I delivered Rohan, and a lot of that like kind of blood, I guess, left my system. But then I noticed in photos when I started smiling again that it looked like I had a gap in my two front teeth, which I had never had before. And so during like a regular cleaning with my dentist, Dr. Gill, I said, like, do I have a gap in my teeth now? And like, could that be caused from that growth? And she basically explained to me that yes, because the growth was there, even because it was large and, basically there for, 3 or 4 months before I had something done about it, that it had caused my two front teeth to shift. And so she recommended I get veneers. I didn't get veneers on just my two front teeth because she thought that it wouldn't mesh well with the rest of my mouth, and I agree with her. So I didn't want to do my entire mouth. First of all, it's outrageously expensive, but I didn't feel the need to. Like, I don't dislike my teeth. So I just had the top 4 done. I do want these done. I didn't wear my retainer, and I still have my wisdom teeth, and I'm a big baby, and I don't want to pull them out. I'm so terrified. Not that I'm terrified of surgery, it's just like, I don't know, getting my wisdom teeth freaks me out, like pulled out. But so she's like, well, I can't fix where you didn't wear your retainer and your teeth have come back together and they are a little crooked until I take out, like I could basically wear an Invisalign on the bottom, but she was like, I need to take out your wisdom teeth first. And so I'm trying to get up the courage to do that so that my bottom teeth can be perfect like my top mouth part teeth are, whatever. So the questions were, how much did it cost? It's going to vary on the dentist that you go to, where you live, those kinds of things. I researched it, and based on what I paid and what I know other people who have veneers and what their answers are, you're typically going to pay anywhere from $1,500 to $2,500 per tooth. So yeah, it's expensive, but it's like the only way you can have the most perfect smile. And if you are careful, like, yes, they can break, but you would have to be really, really hard on them. Like, I don't chew. I obviously don't open things with my mouth or my teeth. I don't, chew on things that are really hard. I'm not like gnawing on things, I guess. So she explained to me that it would be pretty difficult to break them. Like, So I'm not really worried about breaking them. The other question I had was, did they have to shave your teeth down? Yes, they shave your teeth down. I mean, I guess it's probably about like 50%. They look like little nubs before they place the veneers on. I will say that, like, I was in the dentist chair when she was shaving them down before you get like a temporary pair while they're making your permanent pair. And like from the time I started and she started shaving my 4 teeth down and then popping on the semi-permanent ones took like 4 to 5 hours. I mean, it was a long time in that damn dentist chair. So you have to be prepared for that. Like I just brought headphones, and luckily she has like a TV mounted, so I just watched some TV, but I mean, it was a long time. No, it does not hurt, which was another question. That's obviously because she gives you, sorry, I'm just checking my time so we don't run out of time. She gives you, or your dentist will give you numbing shots in your mouth so that you literally can't feel anything. And then even when the numbing went away, I still didn't feel anything. The only thing that has ever hurt cosmetic dentistry wise for me is the Zoom whitening. Holy shit. That was some intense pain. I will never do it again. You couldn't pay me to do it again. But apparently not everybody has sensitivity reactions to it. Like the receptionist in her office can do it like the longest time on the highest setting and like doesn't even flinch. I couldn't even make it on like a lower setting the entire amount of time you're supposed to make it. I was like, no, get me out of this chair. Like it was already that painful. And then the whole night I was just like, I mean, I was like cussing Raj out, and he was like, what is wrong with you? I was in so much pain. So I will be truthful about things that are painful. And Zoom whitening, I think it's called Zoom, right? I'll look it up. I'll make sure. Holy crap, that was painful. Veneers, not painful at all. They'll last forever. The color's great. They look great. They can make them to any size and shape you like. Like I have really small teeth naturally, and I didn't want them to look like chiclets, you know, like rabbit teeth, like to be. So she was really, really good about measuring all of my existing teeth and my original teeth and making sure that the veneers were only slightly bigger. She did tell me that I should go slightly bigger than what my original teeth were, and it would make my smile look better. And when I saw before and after photos, which I'll make a blog post with this video and put before and after photos, I do agree with her, so I'm glad I listened. And she also advised me not to go the whitest color, especially because I wasn't doing my whole mouth. It wouldn't blend together. And when I smile, it's very hard to tell color-wise that they're any different. So, you know, you really have to find a dentist that you trust. I did a lot of research and I really trusted her. But overall, it was a great experience. I love it. I probably won't be getting any more veneers unless she can't fix my like one crooked, like 3 little crooked teeth. Unless she can't fix those 3 by pulling out my wisdom teeth and then me wearing an Invisalign, which is like my next step or my next plan. Unless she thinks that that won't fix my crooked bottom, then I probably will get 3 more veneers just to make my bottom straight and perfect like my top. Because it does bug me when I'm recording videos. Now I'm going to tell you and you're going to stare at it, or things like that when I'm talking. So you guys know me, or maybe you're getting to know me. I'm an open book. I'm always honest about things that I get done. I have one life to live. I want to live it looking damn good, and that's what I plan to do. So that's me. Love it or hate it. That's how I am. But I don't push anything on anyone else, and I respect everyone else's opinion, and you can respect mine. And that's it, guys. So yeah, my veneers, totally worth it. Loved them 100%. Obviously it's an investment. You can do things like Care Credit, which is basically like a credit card where you pay off monthly payments. They offer that for all kinds of cosmetic procedures, from dentists and plastic surgeons, dermatologists, things like that. I think they even do it for your pets, for veterinarian bills. So if you apply and are approved with your credit, you can do monthly payments. You obviously will have to pay some sort of interest based on your credit score, but that is an option too. So veneers, 100% love them, would absolutely do it again, no pain. And yeah, so if you have any questions that I didn't get to, comment below in the video, and then share this video with your friends if they're thinking about veneers. And thanks for watching. Bye.